Spring break often means more time outside for kids, but that can also lead to a spike in injuries.
Dr. Van Der Laan, medical director of the Siena Children's ER, is here to share her insights on pediatric injury prevention. Good morning.
Good morning. Thank you for having me.
It's all good.
Thank you for being here. So let's start off with what the leading causes are when it comes to preventable injuries for young children.
Yeah, so when you think about preventable injuries, you kind of have to think about it in age groups. So in the young children, so less than 1, the leading causes of preventable injuries are going to be related to sleep. So sleep-related injuries. So that's why the AAP recommends back to sleep. They need to sleep in their own cribs, have a semi-firm mattress, no blankets, no toys. When we think about the kind of the toddler age, that's when we start thinking about drowning. As we go into the warmer months and to this pool season, which I'm also very excited for, we do see a spike in pool-related drownings. We always tell parents, we want to make sure that the kids are within arm's length of a parent. Someone should be designated as a water watcher to make sure that the children are safe. But I also want to remind people that drowning don't happen just in pools. They can happen in your bathtubs. It only takes a couple inches of water. And then we talk about older kids, the school age, the adolescents. That's when we start thinking about motor vehicle accidents, firearm-related safety, and then, of course, e-bicycles are on the rise and causing a lot of injuries. Yeah,
the e-bikes, some of those injuries are crazy, but you did mention car accidents. Still one of the leading causes for serious injury and death. Correct. For kids out there. So what can parents and guardians at home do to help protect their kids and make it safer for them on the roads?
Yeah, so children under the age of 2 really should be in a rear-facing car seat. They really should stay rear-facing up until the point they can't fit anymore. So I always tell parents, until their little legs are pretty much stuck on that back seat, keep them rear-facing. It's the safest place for them. Once they are forward-facing, making sure that they are in a booster seat, making sure that you're following the guidelines that follow onto those different mechanisms or different contraptions that they have for kids. And then really, children should not be sitting in the front seat till they're above the age of 12. They should be still in the back seat. Once they're above the age of 12 and tall enough, then they can move to the front seat. And that's just really related to the airbags. We don't want them to hit them at the wrong place and cause more injury. And then, of course, our driving teenagers, we want to make sure that they're following the rules, always wearing a seatbelt when they get behind the wheel of the car and following the rules of the road.
Right.
Yeah. When it comes to preventable injuries at home, what should parents really be mindful of, really across all ages?
So kids get into everything. Toddlers walk, they open drawers, they get into everything. So making sure medicines are kept up high, they're locked into something that is not easy to get into. Making sure that if you have stairs, we have baby gates, because again, toddlers can tumble down the stairs quite easily. If you do have a pool, making sure either you have a pool lock or that the doors are locked in a way that they alarm when they open so that you know your child is outside and could potentially fall into the pool.
Kids have different needs when compared to adults with medicine and all kinds of things. So what are the kind of differences to a pediatric ER to a regular ER that people are used to?
Yeah, so I can specifically talk about my hospital. So St. Rose Siena, which is located in Henderson, we are a pediatric hospital. So what that means is when you come to our hospital, you are going to see a doctor who is trained both in pediatrics and pediatric emergency medicine. So what does that mean? That means we went to 4 years of medical school, we graduated, and then we did an additional 6 years of training to specialize in children and children emergencies.
Wow.
So when you come to our ER, you're kind of seeing a subspecialist. You're seeing someone who is trained in dealing with kids and kids emergencies.
Yeah, when something happens, it could be very scary for a parent when it's their child. So when should someone take them to the emergency room? How do you know which accident or which incident qualifies for that?
So I always tell parents, when in doubt, come see us. We're never going to be upset that you came and saw us. I would rather you come in and me tell you you have a happy, healthy baby than you sit at home. That mom guilt, that dad guilt, that gut you have down in the pit of your stomach is usually true. But I always tell parents, anytime they're struggling to breathe, if they're not acting right, they're not responding to you, this is a time you need to come and see me immediately.
Is there like a common theme that happens at springtime with related to, I know you've alluded to some of them, but is there something that people can do at home just to make sure that those really seriously preventable or really obviously like silly little things that happen around the home that make it safer for the kids this time of year?
Yeah, so we're getting out of winter season, so we're hoping that flu season is soon to end. We're right in the middle of flu and RSV season as we start going into the spring season. So making sure our kids are safe around the pool, making sure we're putting on good sunscreen, make sure when we're going outside we're drinking more water. It's hot here, we're in the desert. So making sure our kids are prepared for being outside when we're entering our spring sports seasons, we're entering soccer soccer, basketball, all the fun stuff. Making sure that our kids are ready for it, making sure they're drinking well, protected, and that they can do their sports safely.
Great stuff.
Well, Doctor, thank you so much for joining us and all your insight this morning. Stay ahead of the game this spring break. For more information on steps you can take to prevent children's injuries, head to dignityhealth.org/NVkids.